I'm the Chief Executive of CARE in the UK, and I'm really grateful to see lots of our supporters online joining, and I want to say a big thank you to all of you for all of the support that you give CARE in so many different ways. And over many years, we can't do the work that we do to help people around the world without your support. And it's really lovely to see you're interested in hearing more about the work that we do in Yemen. I was very lucky to visit Yemen last year, and I'll maybe mention a little bit of that as we go through the webinar today. And whilst I was there, I was lucky enough to meet Bushra and Lina. So Bushra, who you can see on the screen at the moment, I think, as she said, is currently in Hajjah, the north of Yemen, sort of in between Sana'a, the capital of the north, and the coast, but originally from somewhere else. Bushra, do you want to introduce yourself?
Yes. Hi, everybody. I am Bushra Aldukhainah. I am the area manager for CARE International. I've been with CARE since 2010, and I've been like managing 3 governorates in Yemen, which is from the most challenging areas, which is Hajjah, Hudaydah, and Mahwit. It's very, Laurie has been there, and he was astonished to see how the situation is and how people are living and what the situation looks like.
Thanks very much, Bushra. And yes, I'm sure lots of you online will have heard of Hudaydah. It's been in the news a lot over the years. And Bushra and I visited there last February, only a few weeks after the ceasefire of at the end of 2018 had started. And we'll hear a little bit about how things are there. Now, Lina, do you want to introduce yourself? We've heard that you're in Sana'a, but why don't you tell people about where you're from and what role you do in CARE?
Sure. Hi, everybody. My name is Lina Al-Saffi, and I'm the Education and Youth Empowerment Coordinator based in CARE Sana'a office, the country office. I work on education and youth empowerment projects in both the North and the South governorates. My work actually involves a bit of visits here and there. I've been with CARE for 7 years, and I come mostly from a development background. Before I joined CARE, I worked for the World Bank, DFID, and USAID. So my background is more of education and youth empowerment development projects. And I'm blessed to be with CARE here to get the experience I need for the humanitarian. Thank you.
Fantastic. Thank you, Lina. So just so people know, Lina and Bushra both happen to be based in the northern part of Yemen, but CARE works across the whole of Yemen. And I also visited the south of Yemen when I was there. And we also were looking to have one of our colleagues from our Aden office on the webinar. It just didn't work out this time, but we do work across the whole of Yemen. And we are a humanitarian organization, neutral politically, and work on all sides of the conflict to support innocent victims in that war. So, as I mentioned, I was in Yemen just over a year ago, and I want to talk a little bit to Lina and Bushra about how things have evolved since then. As I mentioned, there had been a lot of fighting around Hudaydah just before my visit. We were some of the first NGOs to go back in and see what it was like after a ceasefire was finally agreed at the end of 2018. So Bushra, tell us, is that ceasefire in Hudaydah holding? And what about the calls for there to be a ceasefire across the whole of Yemen to enable people to deal with the COVID crisis?
Actually, when we talk about the ceasefire, it's so hard to say that it has been stopped because the situation keeps changing and is unpredictable, as always in Yemen. So every time we keep thinking, okay, maybe there's like good indicators for stopping the conflict from all parties, but this is unfortunately not happening. They keep like fighting is still ongoing. Sometimes like people and I myself, when I conduct like field visits to Hodeidah, we keep hearing some bombardment here and there. We don't know what is the source or where it is coming from, but people I mean, we don't know exactly who is bombarding here or who is hitting there. Sometimes it's like I cannot, like, if you could see from the previous visits and since a year ago, situation has never changed but only got worse, unfortunately, from all levels. Now when we think about how difficult it was a year ago and how it is getting more and more difficult, sometimes it's really hard to explain for the people outside Yemen how it looks like. Like when we talk about how the poverty situation, the conflict, how it has affected all the lives for the Yemenis, from all levels, from like having a clean water in their daily life, in the education level, on the health level. Every time we keep saying it's getting worse, like it's really hard to explain and to describe how it looks like. Because if you look at the statistics and the numbers of the people affected, it keeps increasing, unfortunately, and situation gets worse and worse by the time. And now with having, I mean, the multiple crises that is happening on the like all over the time, that has started. I mean, if everybody knows about Yemen, it used to be known as one of the poorest countries in the Middle East, but now, since this is the sixth year of fighting and the conflict and how people have been affected and impacted. I myself was like directly affected by the conflict, and I had to displace myself and my family from Harad, where I was based originally when I joined CARE after like joining with a development project, and how the situation keeps escalating all over the time. And it was really scaring us, all of us, having the news of the COVID-19 all over the world, and we were really, really dying of scare, because we were thinking, if the situation, if people around the world were able to be inside their homes, having all the food, I mean, all the services, they have water in their houses, they have access at least to the basic life needs. But how about in Yemen? Like people, they have to, women and children have to travel distances to get water, and not even clean unless it has been supported by humanitarian workers or NGOs.
Thank you, Bushra. And we'll talk about a lot of those issues in a bit more detail in a moment. Now, Lina, let me also ask you a question. So when I was there, you know, one of the things that made people not be able to afford food is that lots of people had lost their livelihoods. Businesses had been destroyed. People didn't have the normal customers that they had anymore. But you introduced me to some people who had found new ways of earning a living with some support from CARE, like Mima, who had been working in a kind of a, you know, quite a modern company doing marketing for them, but she lost her job as a result of the war when they lost all of their business. She instead got a loan from through CARE from the H&M Foundation, started a small business of her own, started selling jewelry in a modern shopping center, and she was now working 12 hours a day, 7 days a week, and earning less money, but seemed to be enjoying being her own boss. Can you tell us a bit more about what's happening to the economy now, and how are people finding new ways to make a livelihood? Oh, you're on mute, Lina.
Sorry. I was just saying that the economy in Yemen has not improved, not even a tiny bit. It has not even remained at the stage where it was since you last visited. Those women are lucky because they were supported by the the Women Economic Empowerment Project, and they've actually made an earning for themselves and for others. And that is something that we are proud of, that we were able to empower people beyond just the earning, but also to support the community. Economy in Yemen is getting really worse. If we look in, if we just quickly speak about how the economy looks like, Yemen's, over the past periods, because we started Ramadan, Yemen's retail markets, maritime and land ports remained open. So we have commodities coming in. It's more about the purchasing power. People are no longer able to afford it. Both locally produced and imported food commodities continued increasing in price, from 4 to around 20% in some cases. And although fuel prices are low, traders are of course ending up using longer routes to get their goods to, for example, cities and areas, or like the markets, which means that as a result, the end user or the customer, the everyday man and women are the ones to pay that cost. As a result, we see that this is linked to another factor, which is we are now at a COVID-19 situation, and that has impacted the way income is created. For example, in Yemen, a lot of people lost their jobs. A lot of businesses are closed. So this meant a lot of layoff. People ended up mostly using daily work in most cases. And even now, those are unable to make sufficient income for their families, especially marginalized groups, IDPs, the poor, and of course, women. And that has ended up also having an impact on food security. We see 53% of the population are severely food insecure in Yemen. This is, of course, with all the support they're getting from international organizations. Without that support, it can hike up to 67%, meaning around 250,000 people at the verge of famine, if I may put it in a nutshell.
Yeah, that's a terrifying number. Now, you talked about women there, and obviously CARE has a big focus on gender equality, and you're also talking about people losing their jobs. Now, one of the people we met when I was there was Asma, who'd set up quite a big business making clothes, big enough that she was doing day shifts and night shifts. And, you know, she had, been able to become a business owner, the main breadwinner in her household. But we know in many other ways, women have been, badly affected by the war, as you say. A lot of violence, early marriage of girls, girls dropping out of school more than boys. Can you tell us a little bit more, Lina, about what's the situation for women today in Yemen?
Sure. One can look at it, of course, the complexity of the situation in Yemen is multi-layered, and by default, it affects women and girls more because of their status or the power dynamics in the country, and that's, of course, context specific. Not to say that has not been an improvement in the way women in certain areas are more empowered. If we look at it, we can say it would be fair to say that men are now, we've done an assessment for the Women Economic Empowerment, the impact of the project, or if I may say, it's a study on the impact of CARE's programming on empowering women. We would say that there has been a change in the way the power dynamics are perceived. Men are more appreciative of the role women are playing. And we're looking at it more also from a perspective of empowering the community. So because we were able, with the example that you just cited, she was able to open shifts for men and women. So this inclusive way of dealing with women empowerment makes it more socially and culturally acceptable. Women are do not have to face all the let's say all the issues that would be culturally sensitive earlier, but are now more acceptable. Men, it's fair to say that men and women's roles and responsibilities are changing. Of course, there's a certain level of resistance remaining because men are more likely to be supportive of women's roles outside the house if they contribute to the household income. But there's also a bit of cultural sensitivity that we have to take into consideration. Women participating in our programming, in CARES programming, are more likely to have supportive attitudes to gender equality in roles and responsibilities compared to others. So that would be my take on it, or if that answers your question.
Thank you. Yeah, that's great. Thank you very much, Lina. Now, so people have heard that the situation has been very difficult for a long time in Yemen and is not improving. But I want to come on now a little bit to some of the specific additional problems created by COVID-19. As I start to do that, I'll also invite people to put any questions as they think of them in the chat box. And I will come back to that soon, but feel free to start putting them in there. Now, Bushra, you talked earlier about the fact that you had been forced to move home as a result of the war. And when I was there, we also had quite a tearful conversation with some of your staff, many of whom have had to move home more than once as a result of the war. And one of the things that people are being asked to do around the world because of the COVID pandemic is stay at home. So can you tell us a little bit about how practical is that advice for people who have been forced to leave their homes?
As I mentioned earlier, this is really one of the difficult questions to answer because to reflect and to give an overview or a picture of what's going on is really hard. Sometimes you cannot find the word, cannot find the proper words to describe it, because now, like, how many people have been displaced? There are millions out of their homes. Like, they have literally lost everything. And now with the COVID-19, we are asking people to stay home. Most of the people, they don't have homes anymore. I mean, the lucky ones who had their families, or I mean, you could imagine like more than 15 person are living in 1 or 2 rooms maximum. And when we ask them, like, they should stay home while they don't have like the basic life services like the water, like the hygiene tools, and also the food. How can they stay home? I mean, how can they? I mean, some people they go for assistance from outside, and most of the INGOs are supporting these people, which is, as Lina mentioned, it's not enough. This is with the number. The numbers we are getting is with the support from the international organizations. Imagine if it is without it. But if we are asking the people, like, they should stick to have cleaning their hands, washing their hands, and have a hygienic, where are the resources they're getting from? Like, if women and children have to travel 1 or 2 hours to get 20 liters water, how can they use it for?
Yeah, absolutely. So, and one of the projects that we looked at in your area of responsibility was a water project, wasn't it? That had been started long before the war, abandoned, unfinished by the government because of the war. Exactly. And we finished that off, and that was meaning that people were able to having water, you know, brought right to their house rather than having to walk for hours and hours a day, as you say. And obviously that means it's possible for, at least for that few villages, to start washing their hands. And of course, one of the reasons that was really important at the time was cholera rather than COVID-19.
Exactly.
But I imagine you're worried about both of those things now.
It is, because now cholera outbreak is again back. Unfortunately, it's both. People now, even they are scared to go to hospitals. Like I myself got sick yesterday, and I was terrified to go to hospital because I know I will get more sick. So I prefer to stay home.
And that is something that's happening all over the world. And I think,
Exactly.
you know, one of the things that this whole situation is showing us is that actually, whilst there are differences, there are also huge similarities in what everyone is dealing with.
Laurie, I have one point
Yeah.
I would just wanted to add, if you allow me. One key aspect to the fact that we also cannot, or the practicality of a lockdown or stay home, is that at the moment, and due to the economy, most of the Yemenis make their daily income through daily labor work. So we cannot ask them to lock themselves in their houses without actually being able to provide for those people. There are people who work on motorbikes. There are people who do like street selling. All those people are making a day-by-day income. So it's quite a tricky and slippery way to handle it when it comes to Yemen. It's multi-layered from where I see it.
Absolutely.
Thank you.
I'm going to come to some of the questions in the chat box in a moment. We've got a great one there already to get us started, but if you want to add questions in the chat box, please do. I'm going to ask one more question of Lina before we do that. So when I was in Sana'a, we went to visit some schools that CARE was helping to rehabilitate. And there were a few problems that we were seeing in the schools, you know, a year ago. Lots of schools have been damaged, lots of children weren't able to go to school, but it was many more girls who were dropping out of school rather than boys. And it was also the case that teachers often weren't being paid. They were having to do a second job to survive. You know, they were really only still teaching out of their kind of sense of duty and vocation. And around the world now with COVID, children are having to learn from home rather than in schools. And I imagine that's even more difficult to consider doing in Yemen. So can you say a little, Lina, about what's the situation with schools today? Are girls still very much dropping out of school? Are teachers starting to get paid? Can you tell us a little bit about that?
Yeah, briefly, I could say that just for the sake of figures, we could imagine that at the moment, the education cluster is like the estimate is that 4.7 million children need education assistance. It happens that I sit in the education cluster, national cluster meetings. I also CARE is a member in the strategic advisory group of the education cluster where I sit. So we can only imagine, like, as I said, 4.7 million children need education assistance, including 3.7 million in acute need. This includes roughly 2 million children who are out of school. And you can only imagine that 36% of this is girls, compared to 24% boys. Families may end up having to prioritize education in difficult economic times. They send children to work because of the need. The number of children who need education assistance is increasing year by year. And the vulnerability of school-age children has increased significantly. And of course, due to the escalation of the war. But we specifically talk about girls because at the end of the day, families have to prioritize. And for families, for many reasons, they would choose to send a boy to school rather than a girl, because basically a girl can, not only limited to what I'm going to mention, she could help with household chores. It's safer for the girl, this is the assumption, to be home rather than out on her way to or back to from school, being exposed to all kinds of dangers. So it's that way of public understanding, or we can also look at the infrastructure. More and more schools were damaged. International partners are working on rehabilitating schools, on providing services, but the need is huge. Teachers' incentives is one of the key issues that the education cluster partners are working on. In 11 governorates, teachers were not paid for over 3 to 4 years. Sometimes they receive half a salary every few other months. UNICEF is providing support to teachers through what's called the teachers' incentives. And that is not even regularly happening. It's disrupted because of bureaucracy and issues between related to information provision from the Ministry of Education, the flow of funds, etc. What we're also doing as international organizations in the education sector is to support teachers. We provide some sort of an incentive, not directly conflicting with what UNICEF is doing, but it's rather than supporting what teachers are doing through paying for transportation, for capacity building trainings, costs, etc. But again, what UNICEF is doing is not consistent. I mean, it's not sustainable. It's not there to stay. It can be available for a year, but not the other. So this issue of teachers not being paid is one of the key issues that we are facing, not across the country, of course, because in the southern governorates, teachers are under the RG, internationally recognized government, and they are paid by that system, but mostly 11 governorates in the northern part of the country.
Thank you very much, Lina. Now, we're almost halfway through, which seems like a good time to shift our focus slightly from what are the problems to what are some of the answers. Obviously, we know that peace is the one and only real answer, and we all hope that that will come very, very soon. But in the meantime, so I'm going to ask Mohammed now to ask his humble and very nicely concise question in the chat box, and then I'm going to come to Bushra and Lina to talk about that. Mohammed, do you want to ask your question? Oh. One more time. There you go.
Yes, good afternoon and peace be upon you, everybody. Yes, first of all, I think it's brilliant that we have this platform to share our concerns and voice our worries for the people of Yemen. And whilst, of course, the Yemeni are a particular people, but we share a human spirit. You know, the ethnicity is what it is, the religion is Islam. But aside from that, which is important, of course, we all have a shared humanity. And the concern is that it seems like this shared humanity is very conveniently being ignored by the so-called superpowers of the world. It's amazing. You know, if somebody has a sneeze or a cough of a particular, who happens to be of a particular ethnicity or a group, people would run to their aid. But right now, the word Yemen does not register on the radar of anybody. Honestly, it's really heartbreaking. I personally, I'm a Muslim, I'm from Pakistan. But as I said before, aside from religious and cultural borders, there's a shared humanity here. And I'd probably express the same concerns if it was a white community of a Christian faith who was being ignored like the Yemeni people. So coming back to my question, and thank you very much, Laurie, for giving me the opportunity to speak, is that, you know, what is being done? And I know that the forum through which I was given the link for this webinar is very important. I try to do my very humble activism. I know I could do much more. But on a large scale, what is being done and what can we do? I know there's many people on this forum here right now, and, you know, even on a local level. But yeah, that's the main question. What can be done to assist these people who are just ignored? And, you know, we have to raise their profile, and, you know, let's see what we can do. In addition to prayer is very powerful, of course, but we have to tie the camel as well. We have to do things practically. So that's my humble question, Laurie. Thank you.
Okay, thank you. It's a great question. What can we actually do? So I'm going to ask Bushra and Lina to tell you a little bit about what CARE, as well as maybe others, are doing in different ways. I'll come to you first, Bushra. Do you want to tell people a little bit about the work that you're focused on in the parts of Yemen that you're working on? We've talked a little bit about water. You might want to say more about that, but otherwise the overall humanitarian response. Tell us a little bit about what can actually be done.
Yeah. Actually, currently we are implementing in care, we are focusing in particular sectors, which is the water, sanitation, and hygiene. We are providing clean water to the people through rehabilitating and protecting the water schemes, the water sources for the people, so they can get them clean because they are open and unprotected. Children are falling and women are falling into that water schemes, which is water wells. We are also providing rehabilitation to the water networks wherever is possible. It depends on the funding and the locations, of course. We are providing, distributing hygiene kits and hygiene consumable kits. We are also conducting hygiene promotion. We have also in the food security and livelihood, we are distributing cash, conditional cash and unconditional cash, depending also in the situation and the context. We are also providing livestock distribution for the people to help them get their resilience and recover their income resources. We are also doing the cash for work, which is also contributing to the community's resilience, and also the education. We are trying to rehabilitate some schools and bring more children back to the schools. We have other sectors in care which is operating in other areas of Yemen, which is the reproductive health and also the inclusive governance.
And thank you very much. Lina, do you want to say a little bit about what you think care is actually able to do to respond to some of these problems?
Yeah, actually care works in an integrated manner. Of course, we were humanitarian driven when the whole conflict started. We worked on all the sectors like life-saving interventions, and we operate in 13 governorates. We are having a new program in Marib, which means that we are expanding our presence in the country, and we reach around 3.4 million people each year. We work, as Bushra mentioned, we work in different sectors, wash, food security, and we also at the same time work on development projects like women economic empowerment, inclusive governance, on youth empowerment, providing seed grants for initiatives as well. Our donors, and I think this is a key point that shows the diversity of our stand. Our donors are not only from one, and I'm just pointing at what was mentioned earlier, our donors come from different parts. It's not only that we are funded by, for example, I'm just citing an example here, DFID or the USAID. We have funding coming from Gulf countries. We have funding coming from different private enterprises. So what we're doing is actually we're looking at what we can do to support at a larger scale. And just like he mentioned, just like Mohammed mentioned, we have that neutrality aspect. Of course, we're lobbying. CARE is working also on, and that's one of the things I do as a coordinator. And of course, under the supervision of senior management, is to work on lobbying and raising funds for, in support of our project, in support of what we're doing in country, be it internally or externally. So the coordination we do happens at different levels. Thank you.
And Lina, do you want to give us a specific example of one of the things that we try and do, for example, to create new livelihoods for people?
Of course, what we do is CARE is working on, or CARE is currently, and Bushra is also, I think she's also better positioned because she's working in the field. In livelihoods, we work on different cash for work. We work on supporting ongoing businesses. So we actually do work with the livelihoods instead of not only providing for people, but also looking at how we can provide sustainable and longer term income for them. And I think that's part of the integrated approach we try to work on. And maybe Bushra, you can add a few points from your end because you do the livelihoods projects on the ground at the field level.
Yeah.
Thank you.
So actually we do, as you mentioned, have an integrated approach, which is through the water, sanitation and hygiene and food security and livelihood. So one of the things that we are trying also to do is to have more longer term impact for the people's lives, so they can stand on their feet, not only waiting for the humanitarian assistance to be received. So we're trying to support them in different ways. So if the water, for example, is being provided, they feel secure, so they don't have to spend half of their days going and coming back just to fetch the water. So if this is secured, and then we try to raise their awareness through the hygiene promotion, and also provide them with, for example, prioritizing their community assets through the cash for work approach. So it depends on the community's priorities and also the assessment that we are trying to prioritize the needs for a certain community, which of the activities that is needed most in this community. So if we are, for example, providing and trying, because most of the people have sold their assets, including the goats or the sheep, so to survive. So some of the communities we are targeting is to support them return such kind of assets, so they can stand on their feet and start raising again the sheep or the goats, so they can have an income on their own. This is as an example for what.
Yeah, that's a great example. Thank you very much, Bushra. Nadine, I'm going to come to you. Do you want to ask your question about hygiene?
Yes, hi everyone. Thanks so much. This is a really interesting session. I just had quite a practical question, really, which is that in the face of COVID, how do you actually communicate any messages that you have about health and safety or information generally to a largely displaced population?
Thanks, Nadine. Bushra, do you want to say a little bit about that? How can we actually talk to people if we're supposed to stay apart from them?
Yeah, actually, we started organizing and coordinating with the local authorities on how we can reach to the communities, and this is like a combined efforts with the local authorities and also the working organizations in the area. So we are communicating like to the people in groups. Like we're trying not to gather people in big numbers. We are trying to give them like in very small groups, to give them kind of training and raise their awareness on what should be done. And also now with the current projects with the distribution, for example, we have this social distance between the beneficiaries, so everybody stands in a circle where we marked for them, so they don't to keep a social distance for the people, and we provide them with the hygiene, so the hygiene items, so they can receive their humanitarian assistance safely. And along with that distribution session, we also try to give the people kind of awareness, and we give them like also posters in the walls, so they can see that this is very important steps that they should keep on their daily life, and also along with the distribution process.
Thank you.
Thanks, Bushra. I'm going to come now to Dean. I think it's probably Dean, unless I'm reading that wrong. You had a question about progress being made. Do you want to ask your question?
Yeah, actually it's Diane. My name is Diane.
Okay.
Yeah, it's just a general question, and it's coming out of anger or frustration, because like I've attended a few webinars, and like they keep saying we did this and we did that, like, but on the ground, like we see the crisis, the humanitarian crisis, just getting worse. So I don't know. It's just like we don't see any progress, or maybe if there's any progress, it's just very little progress. Like it's a general question.
Yeah, okay, great.
Yeah.
Thank you. And as I mentioned earlier, I think obviously peace is the thing that would get us the fastest, biggest progress. But beyond that, Lina or Bushra, do you have any thoughts on other ways that, you know, could make a really big difference and help make more progress?
I think
work can continue funding until, so we cannot only have one-way solution. I think, as you mentioned rightfully, it's through political solution that this situation can come to an end and improve. But in the meantime, that does not mean that we do not do what we need to do to make sure that people survive. So I think it goes hand in hand with continuing our humanitarian support, our presence, even increasing that presence because of the COVID-19, which added another layer to an already complex situation. And lobbying is a key aspect in that. Thank you.
And one of the things you mentioned, funding as well. One of the things that we'll with all the other NGOs be lobbying for is a good outcome from the Yemen pledging conference, which is happening in the next few days. Bushra, did you want to add anything?
I just wanted to add, I think what keeps lots of people surviving is the humanitarian aids so far, because if we look at the situation, I think more than 95%, if I'm not very good at numbers, but it's more than that number, they have lost their incomes. And if we look at the humanitarian organizations who are providing the support to these people who are working in the organizations and to the people around them. So if we cannot see the progress, because it's a very devastated situation, because it's all collapsing together. Multiple crises is happening one after another, and it's very hard to see any progress. And luckily that the humanitarian assistance is still delivered, which is whatever progress is being made to the people just to keep them alive.
Thanks, Bushra. Now, when you and I traveled from Sana'a to Hodeidah, I got a good first-hand example in various ways of how difficult sometimes it is to deliver assistance to the communities. We went through, I mean, I literally lost count of how many road checks between Sana'a and Hodeidah. You know, there's always huge amounts of paperwork that has to be filled in to implement programs and all of that kind of thing. And I can only imagine that COVID has made it more difficult. Do you think there are things that could be quite practical things that could be done to make the delivery of aid easier and therefore quicker and better?
Actually, just keeping what we do is the best thing that could make it better, because we are in a conflict zone and it's very, very complicated situation. So the only thing is we keep resisting on what we do and continuing what we do.
So despite all the challenges, you mean, just keep it up?
Yeah.
Okay, very good. Now, Marwa asked a question here in the chat about the balance between empowerment and education projects versus humanitarian projects. And I actually wanted to just take a go at answering this one, because I think it's a really important one. And when I was there in Yemen, we had lots of conversations with our team in Yemen about how our program used to be all about economic empowerment and livelihoods for people and longer term resilience. And it had to switch to being mainly about humanitarian, partly because of the situation, but partly also because all of the funders made that switch as well. And so we were doing quite a lot of talking to funders about saying, actually, there should still be some space in the budgets here for longer term livelihoods. It's what people want. It's much more cost effective and sustainable when you can do it. Of course, there are some people for whom it's not going to work right now. There are no livelihoods opportunities necessarily for everyone, but for the people who there are, much better to give them those livelihood opportunities rather than humanitarian aid, and that's what they want. So the answer to Marwa is that we would also like to do more of that, and funding is one of the limits on that. Let me come to Rosamond's question. I think that's a very interesting question. If you would like to ask that, Rosamond, please.
All the help coming from the needy is obviously responding to the multiple needs, and it's quite a crisis you have out in Yemen. But what I was wondering was, is there a vehicle for the needy themselves to express their concerns? Is there a place? Is there a venue? Is there a something? I know it's a displacement. I know everybody's displaced. I know people don't have homes, but is there any way that they can express, even if it's only an anger and frustration, or a call for help, or a solution themselves, you know, to make them feel more empowered? So it's not just coming from the outside in, it's coming from the inside out. That's sort of what I was thinking.
It's an excellent question. And let me come to Lina and Bushra. Lina first.
Yeah, I'm just trying to make sure that, thank you for the question. I'm just trying to make sure that I understand it correctly. So the question is, for us, are we getting also the feedback and concern from those who we support, or is it a general question of the needy in general in Yemen being able to voice out their concerns?
To voice it, but also a mechanism by which they can voice it, you know, some place, some area, some, you know, I mean, if I want help here in England, if I'm ill, I can ring the NHS number, or I can seek help from a counsellor or a therapist or whoever. I can do that because I can make that contact. But I'm wondering, is there any way they can have a sort of initial contact for their troubles, if you see what I mean? I don't know, I'm expressing very well.
Yeah, through our interventions, I can put that in the context of what we're doing. What we do is that when we provide support, we do not only provide support, or our interventions are like humanitarian only, not really understanding what people are going through. There's also this psychosocial support side of what we're doing. We have, we listen to the concerns of people. We listen, and maybe Bushra, you know that better, that when we go to a community, we do not come with a ready-made intervention and just put it there. We make sure that it's built on the need, the actual need of people. So that's one way of us ensuring we are doing what we can do to ensure that we're actually responding to the actual need. So when there is need for water, we would not go and provide seeds, because if without the water, those people cannot plant their seeds. So that's one way of us, with our capacity, within our capacity, are trying to respond. One other example is we provide, given all the crisis that we're going through, we try to provide psychosocial support, protection services. We try also to provide, like we refer cases, there's this referral of cases of people who are victims of one thing or another. So this is what we as CARE are trying to do.
Thanks.
To that,
yes,
can I
go ahead, Bushra. Please do, yes.
It's also that before conducting any, like carrying on and implementing any of the projects that we do, is we conduct kind of assessment to the people, and in different sectors, so multi-sector assessment. So what are the needs, their priorities, and we talk to them, and we make sure that we listen to the people, we hear them very well. Even like we go to, I mean, it takes lots of efforts to coordinate such kind of assessments, lots of paperwork, lots of coordination, the local authorities with all the relevant stakeholders, but we listen to the people. We provide their needs according to what they prioritize. So sometimes it depends also on the funding, and of course, the more fund we have, the better assistance we can provide.
Thank you. Now, I think I've got time for one last question. If anyone wants to be very quick and get it in the chat box. You're welcome, Marwa. Thank you. I'm going to give that 20 seconds just to see if one arrives. Not sure if I can. Sometimes you can, on WhatsApp, you can know if someone else is typing, can't you? But I don't think that works here. Okay, great last question from Freya. Do you want to come in and ask your question?
Hi, yes, I hope you can hear me all right.
We can.
The media coverage in the UK at the moment in covering Yemen is very limited, so we're not too sure what's happening if your hospitals are overrun. Could you just give like a brief description on how your hospitals are coping? Thank you.
Bushra, do you want to go first?
Yeah, actually, the hospitals are working with less than half capacities as it used to be. I mean, looking at the very poor infrastructure that has been destructed by the conflict, by the airstrikes, it's with half capacities, and less than the half capacities are working with the current one. And of course, due to the blockade, lots of medication, there's lots of shortage of medication, and lots of equipments are not there in the hospitals, and that's what scares us out of the COVID-19. So unfortunately, if we tackle the COVID-19, we keep hearing the news of lots of cases, but it's not reported because people, they are now more scared to go to hospitals, and even when they get sick, they don't get the proper treatment they should. So unfortunately, even within the country, we know that it's really very weak infrastructure on the ground.
Yes, I mean, in the UK, we talk about needing, tens of thousands more ventilators, and in Yemen, I think I saw that, there was, a few hundred or something, and only 3,000 intensive care beds, I think. So yeah, very, very different. Lina, do you want to add?
Well, Bushra just summed it up, but what's actually, I just wanted to add that now with the COVID-19, what we're trying to do, CARE is not a health organization, of course, but what we're trying to do is we're trying to work through the WASH cluster. As a member of the WASH cluster with other INGOs, there's the WASH cluster strategy. That one of the objectives of the strategy is to support the health facilities and hospitals, especially with the COVID-19. And actually, we are doing that, providing PPEs, proposing that we provide PPEs, hygiene promotion, awareness raising, all that. So we are trying to support a quite fragile system, but with all the support that we can, because we're talking also about hundreds of pregnant women who are also at the risk of contracting coronavirus, which is running a higher risk given their status. Thank you.
Thank you. Right, I think we're going to wrap up there to make sure everyone can get to whatever they're doing at the top of the hour. I have just put in there in the chat box there a link to more information about what CARE is doing in Yemen. If you would like to click on that and have a look, it also means you can make a donation to our work in Yemen if you would like to. I want to say a big thank you to all of you for joining us today and for taking an interest in CARE's work in Yemen and for all of your support over many years in many different ways. A big thank you, of course, to Bushra and Lina, and please pass on our thanks as well to everybody else for CARE working in Yemen, and all of our best wishes, and we will see you again soon. And thanks as well to my colleagues, Alex, Hannah, Joe, and others who have helped to organize this webinar behind the scenes. We hope to do another webinar soon with colleagues from another country, and thanks to Lillian for her suggestion. We may take you up on that, and that might be the next one. And we look forward to seeing lots of you again very soon. Have a good rest of the week.
Thank you,
everybody.
Thank you.
Thanks, Laurie.
Thanks, Laurie, and everyone.
Thank you.
Thank you. Thank you. Thank you, thank you.
Thank you.
Thank you.
Thank you.